Common symptoms of borderline personality disorder, BPD, fear of abandonment and avoidance behaviors. One of the most defining and distressing symptoms of borderline personality disorder, BPD, is an intense and persistent fear of abandonment. This fear is often at the core of many of the emotional struggles and behavioral patterns that individuals with BPD experience. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the fear of abandonment, how it manifests in individuals with BPD, and the related avoidance behaviors that often arise as a result. Understanding these symptoms is essential in recognizing BPD and providing effective treatment. What is the fear of abandonment in BPD? The fear of abandonment in BPD is a profound and irrational fear that loved ones, friends, or partners will leave, reject, or abandon the individual. While many people experience concerns about rejection or loss in relationships, the intensity and the emotional response to this fear in individuals with BPD are extreme. This fear often stems from a combination of early attachment issues, unresolved trauma, and emotional dysregulation, all of which are common features of BPD. Individuals with BPD may perceive even minor events, such as a partner needing space or a friend not responding to a text immediately, as signs of impending abandonment. The response to these perceived threats can be overwhelming and disproportionate to the actual situation, leading to emotional outbursts, desperation, or anxiety. This fear of abandonment is deeply rooted in their sense of self-worth and emotional stability, which can feel fragile and dependent on the presence and validation of others. How does the fear of abandonment manifest in BPD? 1. Overly intense reactions to perceived rejection. Individuals with BPD may experience overwhelming emotional reactions when they feel even a hint of rejection or abandonment. These reactions might include anger, sadness, anxiety, or panic, and they often occur in response to real or imagined signs of rejection. The fear of abandonment can lead to a heightened sensitivity to any change in a relationship, whether it's a loved one becoming distant, needing time alone, or making a comment that could be interpreted as criticism. 2. Clinginess and overdependence. To prevent perceived abandonment, people with BPD may become clingy or overly dependent on others. They might constantly seek reassurance from their loved ones, excessively call or text, or express an overwhelming need for attention and validation. This behavior is driven by the intense fear of losing the relationship and is often a way of trying to control or prevent the perceived threat of abandonment. 3. Idealization and devaluation in relationships. The fear of abandonment can also lead to splitting, a psychological defense mechanism in which individuals with BPD see others as either all good or all bad. In the idealization phase, individuals with BPD may view a person as perfect, loving, and supportive. However, when they perceive any slight or threat of abandonment, they may quickly shift to the devaluation phase, viewing the person as completely untrustworthy, uncaring, or even hostile. This extreme shift in perception can create instability in relationships and cause emotional turmoil for both the person with BPD and their loved ones. The intense highs and lows in relationships are often rooted in the person's struggle to cope with the fear of abandonment. 4. Self-sabotaging behavior. To prevent rejection. Paradoxically, the fear of abandonment can lead individuals with BPD to engage in self-sabotaging behaviors that unintentionally push people away. For example, they may test relationships by creating conflict or withdrawing emotionally to gauge whether the other person will stay. These behaviors are often unconscious attempts to confirm that others will not abandon them, yet, they can lead to the very outcome the person fears. This can include pushing people away before they have a chance to leave, or engaging in dramatic behaviors designed to elicit attention or demonstrate the depth of their emotions. The fear of abandonment drives the need for reassurance, but these actions often escalate tensions and create additional emotional distance. Avoidance behaviors related to the fear of abandonment. In addition to the clinginess and intense emotional reactions that arise from the fear of abandonment, individuals with BPD may also engage in avoidance behaviors. These behaviors are often strategies to manage or protect themselves from the distress of potential abandonment, but they can paradoxically exacerbate the problem. There are two primary forms of avoidance that are commonly seen in individuals with BPD. 1. Avoidance of intimacy and emotional vulnerability. In an attempt to protect themselves from the pain of abandonment, some individuals with BPD may avoid becoming emotionally close to others. They might push people away or avoid forming deep connections altogether to shield themselves from the risk of being hurt. This behavior is often rooted in the belief that it is better to avoid closeness than to risk being abandoned or rejected. This can create an internal conflict. On one hand, they long for connection and intimacy, but on the other hand, they fear that such closeness will ultimately result in betrayal or rejection. This push-pull dynamic can lead to a sense of emotional confusion and relational instability. 2. Avoidance of conflict or confrontation. Another common avoidance behavior is the avoidance of conflict at all costs. People with BPD may be so terrified of triggering a response that could lead to abandonment or rejection that they avoid addressing issues in their relationships, even when it would be healthier to have an open conversation. They may suppress their emotions or let resentment build up, rather than risk confrontation or disagreement. In some cases, individuals with BPD may completely withdraw from a relationship or social situation to avoid potential conflict, leading to emotional distance and, in the long term, reinforcing their fear of being abandoned. Impact on relationships. The fear of abandonment and related avoidance behaviors can have a significant impact on the relationships of individuals with BPD. Their loved ones may struggle to understand the intensity of their emotional responses, leading to frustration and confusion. The fluctuating nature of the fear of abandonment, moving between clinginess and emotional withdrawal, can create a roller coaster of emotional highs and lows, making it challenging for both the individual with BPD and their loved ones to maintain stability in their relationships. Family members and partners may feel overwhelmed by the constant need for reassurance, or they may feel rejected or pushed away when the individual with BPD withdraws. The relationship dynamics are often characterized by intense emotional conflict, misunderstandings, and fear, which can lead to a cycle of instability. Treatment and coping strategies. Therapeutic approaches, such as dialectical behavior therapy, DBT, are particularly effective in helping individuals with BPD manage the fear of abandonment and related behaviors. DBT focuses on mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness, all of which are essential in addressing the root causes of the fear of abandonment. Mindfulness teaches individuals with BPD how to become more aware of their emotional responses in the moment, without overreacting or acting impulsively. Emotion regulation helps them learn how to manage intense feelings of anxiety, fear, and anger. Distress tolerance skills help them endure emotional pain without resorting to self-destructive behaviors or impulsive actions. Interpersonal effectiveness skills help them communicate their needs and feelings in a healthier way, without resorting to clinginess, manipulation, or avoidance. Through therapy and the development of coping skills, individuals with BPD can learn to manage their fear of abandonment and improve their relationships. Over time, they can develop more stable and fulfilling connections with others, while reducing the intensity of the emotional pain caused by abandonment fears. Conclusion. The fear of abandonment is one of the core symptoms of borderline personality disorder, BPD, and it can lead to clinginess, emotional instability, and avoidance behaviors in relationships. Individuals with BPD may react with intense emotional distress to perceived rejection or abandonment, and they often engage in self-sabotaging behaviors to protect themselves from the pain of losing loved ones. Conversely, they may withdraw emotionally or avoid intimacy to shield themselves from the fear of being hurt. Recognizing the role of fear of abandonment in BPD is crucial for both diagnosis and treatment. With appropriate interventions like DBT, individuals with BPD can learn to manage these fears and engage in healthier, more stable relationships. In future episodes, we will continue to explore how treatment approaches can help individuals with BPD reduce emotional instability and build fulfilling connections with others. Stay tuned for more insights into managing borderline personality disorder.